Living with daily persistent pain is exhausting. Even the thought of overcoming our pain seems insurmountable. Understand why pain is complex and learn actionable steps that will improve your quality of life. Now let's join Amber Kylick on A Path from Pain.
Let's talk facts. Back pain is not the most straightforward thing. In fact, I would say that it is quite a mess of yarn. And when we continue to pull at one piece, thinking that this is the piece that will fix us, we create a big knot and get frustrated in the process. You may have already known this, but it's likely that you are still trying to find that one answer. I get it. So let's take a look at some research to help us find some clarity and maybe some answers. First, please hit that subscribe button. And at the end, please comment below. I'd love to know who's listening. All right. 84% of people will experience back pain in their lifetime. In fact, at the moment, there are 540 million people living with back pain. More women live with back pain than men. The peak age for back pain in men is in their 40s, and in women it's in our 60s, but it does start to climb in our 40s. Side note here, this is something that interests me. Why the later age for women? Could it be menopause related? If you know, let me know. Either way, this means that getting older isn't a reason to justify living with back pain. And this may blow your mind, the majority of back pain will get relief without ever seeking care or treatment. We'll talk about that research in a minute. I know that sounds like it may be boring, but these stats will definitely surprise you. If you didn't already guess, today we're talking about back pain, the numbers that come from research in relation to the why of back pain, when to seek treatment, and what that treatment should look like. This could be a long one, but I'm going to hit the few key points. If you'd like me to build on something that you've listened to, just let me know. If you've been following me, you'll know a little bit about my background. Active lifestyle, racing skeleton, yoga therapy, back pain that started seriously in 2012. By 2014, with 2 little kids, both under the age of 3, I was struggling to get daily tasks done. Needed slip-on shoes because bending over wasn't an option. I was trying one prescription after another to find something that would help. Nothing did. In 2016, I lucked out. A good friend of mine mentioned that I should look into Explain Pain by David Butler and Lorimer Moseley down in Australia. That is truly when the puzzle pieces started to fit into place. Not all of them, not all at once, but it was providing me with a breadcrumb path that I was now able to make sense of. But back pain is different for everyone. We're all looking to the medical system to fix it, but how much help are they sometimes? So let's look at the 2 general types of back pain as I see it and how the medical system can help us. First, if you have acute back pain, in other words, your back pain came on all of a sudden, maybe there was an incident that seems kind of minor, maybe not, but it's recent and likely painful. If you have had a serious accident, that would be a red flag. One of the things that we'll talk about closer to the end of the episode. I'm talking about fairly non-specific back pain that typically accounts for 90 to 95% of all acute back pain. So here's a few stats that may annoy you or help you out. 50% of people with back pain without any medical help will recover within 5 days, and 70% will recover within a week. I know what you're thinking. Lucky them, I wish that were me. But looking more long-term-ish, 86% of people will recover within 3 weeks, and even without medical intervention, 91% will recover after 6 weeks. But here's the kicker. As much as those stats are promising, and now you're wondering what you should be doing anyway, there's a 69% chance that your back pain will return within 1 year if you don't do anything. With these statistics, it isn't surprising that back pain is the leading cause of disability worldwide. And despite all the claims that this is the one best exercise or the one best stretch, Back pain has been on the rise and has doubled in frequency, especially within the 45 to 55-year-old group between 1990 and 2015. That doesn't set us up for a great outlook heading into 2030. So while it's a comforting thought that acute back pain will go away on its own, you need to do some work while that back pain has subsided so that it doesn't return, or if it does return, it is so much less. We'll talk about that in a minute. But before we do, back to those stats. That's all without any medical help. And guess what? It was shown that medical intervention doesn't really change those stats. In fact, if you go to your doctor and get imaging done, it's actually more likely that your back pain will become persistent. Think of that big ball of yarn again, trying to pull at one end and the knot keeps getting stronger. Not to mention the increased healthcare costs. In terms of relying on that imaging, this is a tough one, even for me. I love seeing what's going on in my spine. But here's the dirt. If you take 100 people in their 50s off the street who have no back pain and put them in an MRI, you'll find that 80% of them show signs of degenerative disc disease, and 60% of them will show signs of a disc bulge. Now, I could list all the stats for each age group, but even the stat that 52% of those in their 30s will show signs of degenerative disc disease. I mean, think about it. They don't have pain, but clearly there is a structural aspect. So, one of the issues is imaging and its overuse. And tied to that is the language that comes back from the report. This language can put us off the deep end, so to speak, in terms of how we see our bodies and the fear that comes from hearing our spines are apparently so fragile. I'll say, and I'm guesstimating here, 99% of people who get their results now see themselves as fragile and broken. I've worked with a good handful of people who share with me these imaging reports, and I read them, and then I tell them, even when they're 25 years older than me, that their spines are actually in decent condition, usually much better than mine. But here's the thing. All these results could have come from people without pain. So we need to know that our spines are so much stronger than we've been told. That is where healthy living and movement come into play. Sure, the bone structure might be deficient, but if we have strength in the muscles that support these structures, we will be so much better off. So here's something to follow in terms of imaging. Let's give you 3 rules. You only need imaging if 1. There is a serious pathology suspected. And I'll admit, even this can be a gray area for some. Number 2, there's been an unsatisfactory response to care. Number 3, the results from the imaging are more than likely going to actually change the treatment. If we follow that, we would likely reduce the frequency of imaging by 50% at least. Like I said before, I love seeing the pictures that I get of my spine. I'm a geek that way. But now that I've learned about and experienced my own back pain, I look at those pictures and correlate the level of my health. And I think, wow, I can actually do a lot for someone who may have back pain. Why is that? There are so many factors that affect back pain, and maybe you've heard that pain is in the brain. Yes, it plays a part. So it needs to be included when looking at treating back pain. And I talk about this quite a bit in the previous pain reprocessing therapy episode. So let's get into the second general type of back pain, persistent back pain, often referred to by some medical professionals as chronic pain. This is pain that has been around for longer than 3 months. At this point, there is likely a neuroplastic aspect to our pain. That this is the part that's influenced by our brain, or as I see it, our nervous system. I've talked about this before, how our nervous system is trying to protect us, but it becomes hypervigilant and tries to signal us about things like stress and overload and conflict that it sees as dangerous, but is certainly not tissue-damaging danger. This is usually the point where we're desperately searching for that fix, that right answer that will get rid of our back pain. Often, as you'll guess, the medical system does some imaging and finds something wrong structurally, and then you're told, yes, we can fix it, or no, we can't. I was given the option of fusion as my discs had degenerated past the point of a possible transplant. Yes, they can transplant discs. And this becomes a murky area, and you have two choices: to continue the search for the fix or go for the surgery, and or start learning. Then, no matter what, you can make an informed decision. One thing that you'll have to start doing if you're hoping for any quality of life in the future is to begin a movement program. This can start from a seated position. I always say, if you're breathing, you have a starting position. And I've worked with clients who are in wheelchairs and very, very sedentary. Now, if you've done the math earlier, you'll have figured out that there's still a 5 to 10% number of people with back pain that does require medical help. How do you know if you're in that group or in the 90 to 95% group? That can be a tough question, but let's talk about the top red flags that may, yes, I say may, indicate one of the top 5 red flag conditions. And the top red flag conditions are a fracture in your spine, a malignancy, which is cancer related, an infection, axial spondyloarthritis, and cauda equina syndrome. So let's look at 4 basic questions to ask yourself. Was there a significant trauma? This could indicate a fracture. Are you also experiencing an unexplained weight loss? This could indicate a malignancy, especially if you have had cancer in the past. Are you experiencing fever, chills, and/or sweating? This could indicate an infection, especially if you have currently had an infection. Have you experienced the loss of bladder and/or bowel control? This could indicate cauda equina syndrome. But here's the thing. When we look at the numbers, even if you answer yes to one of those questions, based on the research, at the highest, you have a 20% chance of a confirmed diagnosis. And it was found in relation to actually answering yes to 2 questions, like I mentioned. So if you answer yes to the trauma, plus you're over the age of 70, that's the 20% chance of being confirmed with a fracture. If you look at losing your bladder and bowel control, the chance of a confirmed diagnosis of cauda equina is actually only 1%. Everything else is about the 10 to 13% range, but it's still low. So if you haven't noticed yet, back pain is a gray area, treating it even more so. So let's look at treatment. In terms of the bottom line in looking for effective treatment, as much as acute back pain will likely recover on its own, finding treatment does help, especially if it's helpful to your mental health. But what should you look for? As we know, not all in the medical system are trained in pain. The person that you ask to help you should help you minimize fear, not tell you to avoid movement, not tell you that your body's out of alignment. They should promote movement and active therapy that is manageable for you at this time and be able to help you tweak the program in the future, not just give you the same exercises. They should also talk to you about healthy living, as there are some things that clearly increase inflammation in the body and are not helpful in any way. We'll talk more about this in the future episode, but FYI, sugar, smoking, and ultra-processed foods, those are right up there. With that being said, the person that you get treatment from should also help you deal with and/or clarify misinformation. Not an easy thing to do when back pain is such a gray area, and realistically, we can make things sound so common sense when there's actually no research behind it. But There's lots of new info coming out all the time, and it is possible to keep up with some of this research. This person should also, and this one's an important one to me, give you tools to deal with your pain should it flare up. It is likely that at some point it will flare up. And giving you tools to deal with it on your own, like in the middle of the night when your treatment person's not accessible, gives you more confidence and does help with pain so much. They should also give you an acceptable parameter for your pain when you're doing the activities that you love. With that being said, I do hope you have some solid takeaways from this episode and maybe even some more questions. Please drop a comment below and let me know. Honestly, I could talk about this for hours. Remember, complex pain is not black and white. Everyone who experiences daily pain is unique and deserves to be heard so that you can learn to build a path from pain. Interested in learning more? Check out some of the articles. My YouTube channel, Critical Movement YYC. Join me maybe for the free 5-day Change Your Pain program, or message me and learn how I can help you build your personalized path from pain. Either way, hit that subscribe button. If you like this episode, let me know why in the comments below. If you learned something that's helped you, please share this episode with a friend. Word of mouth is my best friend. Let's keep working together and learning how to build our path from pain.